what kinds of questions are you asking them? Are you asking them to do a contact? Are you feeling sick? Are you testing them?
Exactly. So we're trying to understand what the contacts might be, who they are, where, travel, symptoms, any other things that might be related to that, to understand any kind of pattern that we can see.
And how many people are on this list that you're calling?
I don't have that information. I don't have that.
Just recall, apparently this one individual has very mild symptoms or milder symptoms, which is apparently a pattern throughout most of the cases in the United States, with the exception of the Texas case, which was actually a Mexican toddler. Do you have any explanation, or scientists that you've talked to, the CDC, come up with any explanation about why the U.S. cases are milder?
No, that's why with our team of people from CDC have gone to Mexico to try to understand that situation so that we could begin to answer that. But we don't understand that at this current time.
Can you quickly
just relating back to your question, I want to underscore that based on what we know now, the cases in the United States, for the most part, have symptoms like seasonal flu. So we want people to understand that it's not a situation at the current moment where if you were to contract this, it is necessarily lethal. It appears to be equivalent of getting the seasonal flu. It's not pleasant. It still represents a significant health threat, but it is not unlike what many people get every winter.
Can you explain why
about this, the equipment that you'll get from the CDC to do the testing here?
You know, I don't know what all the equipment is. I know it's just that we'll be getting that equipment, so I don't have any more information. If you want more, we could follow up with some lab people with that. But again, just to emphasize, we are going to see more cases. We're going to have to watch the pattern of those cases, watch the severity. There are teams of epidemiologists who are trying to understand this, and we'll communicate as soon as we know any more information about what that looks like at this time. But we are prepared as a huge system in place to be able to deal with whatever severity, whatever spread should come in this state.
I should also mention, I'm not sure the CDC is sending equipment. I think they're sending, it could be the antigens or the chemical compounds or protocols around that, so it's not necessarily hardware that they're sending up. The broader point is they're sending all states the ability to do in-house testing now that they've got a protocol on how to do it.
Why is it 7 days? Can you talk a little more about what's going on in the school at that time? Why is that time frame? What's happening?
It's based on CDC guidelines and the period of people being infectious, and so we just follow the CDC guidelines in that regard.
Is there like cleaning in the school during that time, or are there things going on? Or?
The superintendent is undertaking, and we've recommended through the Department of Health, some just common sense cleaning. It appears that this virus can be eliminated through common disinfectant. It doesn't take any extraordinary agents in that regard. So I think the superintendent and his team are committed to do some disinfecting of commonly touched items, drinking fountains, doorknobs, handrails, things like that during that 7-day period.
As healthcare providers, can I just ask a question? Can you comment on the perception of Tamiflu or influenza may be helpful if I had an exposure?
Yeah. At this point, we are working on guidance for providers on that. We have to be careful about overusing that early here. Remember, this is a marathon, not a sprint, as far as thinking about how we may need to deal with this for a long period of time. So we do have Tamiflu and influenza in our stockpile at the state. We are getting additional stockpile, so we're prepared if the severity should change. We are not recommending that people start taking it prophylactically at this point in time. We're going to continue to look at that guidance, look at guidance from CDC, but we really need to think carefully about how we use the stockpile that we have if we're in for a longer period of time with this. But we are in the process of strategically placing some of that stockpile out in the community, in regions, so that it will be readily accessible in case the situation changes.
And we're also going to need the cooperation of the healthcare community and the health providers to use the Tamiflu and influenza under this guidance, and be careful about how and when they dispense it according to the guidance.
Okay, thank you, everybody.
Thank you, everybody.